My name is Mary Buchwalder, and I'm a physician and the medical director of the health center. Swine flu, the concern is that it is a new flu virus. Most flu viruses from year to year change a little bit from year to year. Swine flu, because it came from a pig flu virus, is different enough that most people don't have any natural immunity, so they're more apt to pick up the virus, and potentially it could change a lot where people would be more likely to be really sick. So far we haven't seen the really sick part, but it has been very contagious. At this point, it's not particularly dangerous. It's just pretty much like the regular seasonal flu as far as severity and chance of having problems or chance of dying from it. However, the concern, because it's a new virus, is if it mutates a little, it could be like, it's not an Ebola virus, but it could cause really serious complications. College students are at more risk generally for a lot of infectious diseases because you guys live in a communal setting. A lot of students don't get enough sleep, don't eat properly, they're not very good about hand hygiene, cough hygiene, so things can spread pretty readily in a college environment. This flu virus is different enough from any of the previous ones that young adults seem to be at higher risk generally than older people. Normally with seasonal influenza, old folks are the ones who are at high risk of getting hospitalized. With this flu, the cases that have been more serious have been primarily in young people. Follow healthy habits. Make sure you're getting enough rest, try to wash your hands regularly or use some hand sanitizer on a pretty regular basis because germs live on surfaces like doorknobs and such. Try not to touch your face because if you get germs on your hands, you spread them into your respiratory system by rubbing your nose or playing with your eyes. So not touching your face helps. The other thing that's really important is good cough hygiene. If you are sick or if your friends are sick, just remind them to cover their coughs. If they have nothing in their hands, they can cough into a sleeve. If they've got a tissue handy, they can cough into the tissue and throw it out. If they cough into their hands or sneeze in their hands, good idea to wash them or use the hand sanitizer so those germs don't spread everywhere. As far as telling the difference between a cold and a flu, that's a pretty common question because a lot of kids get sick with colds, and that's a whole lot more common than the flu. Colds usually come on a little gradually, nasal congestion, maybe go into a cough, and fever usually is low grade with a cold. If someone feeling fine and usually flu comes on pretty suddenly, so it hits them hard. A lot of body aches, chills, usually a fever above 100, a lot of times it's above 101, bad cough, a lot of sinus congestion, headache, pain. It hits hard, and so usually the flu is a lot different than just the usual cold. If you think you might be sick, take your temperature if you can, because that gives you an idea. If your temperature's pretty normal, it's under 100, probably it's not the flu. If you take your temperature and it's 102, you probably should get checked. To come to the health center, just give us a call. We'll be happy to see you and let our receptionist know that you have a fever or that you think you have the flu, and we'll get you in. One of the nurses will check you in, and one of the doctors can take a look. If we have a lot of demands for that, the nurses will assess and then get you to the doctor if need be. If your roommate's sick with any kind of illness, there's always a period where when they're sick, you've already been exposed. Just being careful, being good about making sure the sick roommate is washing their hands and covering their coughs will reduce your risk of problems. You don't have to isolate yourself. There's a lot of hype because it spreads so well and because it's new and because it has potential to be bad. But right now it's not bad. So at this point, panic is not the right reaction. Knowing that it's around, but taking care of yourself, just general care, is the right reaction right now.